When you hear the word fatigue, you immediately associate it with being tired and not having enough energy. Actually, there's more to it than just being sleepy or exhausted from a busy day. Fatigue can be caused by one of many medical conditions or even mental conditions, or it could be a product of your lifestyle. Here on MedTalk Health Talk, we'll talk about what's behind your fatigue and how to prevent and treat it and its possible relation to COVID-19. I'm Dr. Freddy Gomez. You're watching CNN Philippines. You've been feeling constantly tired or weak. There could be a number of reasons why. Don't wait until fatigue affects your day-to-day. Your doctor will be able to tell you what's causing it. The sooner you know, the better for you. Our guest today will tell us more about this. Welcome to the show, Dr. Michael Alexius Sarte. He's a sleep specialist and the consultant director of the Center for Snoring and Sleep Disorders at the Medical City. We're also joined by Dr. Geraldine Zamora, who practiced rheumatology at St. Luke's Medical Center and co-founder of Hope for Lupus. Thank you both for joining us. Now, fatigue can affect anyone. In fact, most adults experience it at some point in their lives. But what's actually causing it? Doc Jing, is it that simple? What could be the causes for fatigue?
Doc Freddy, there could be many causes. Like you said, fatigue is not just being sleepy or feeling tired. It's really something that makes you feel exhausted. You cannot get out of bed. So many possible causes. It could be as simple as lack of sleep, chronic lack of sleep, medical conditions including anemia, infections. A lot of our patients with autoimmune conditions have fatigue.
Fatigue is a symptom of unhealthy lifestyle or an unhealthy physical condition, or maybe even both. But for most, it's caused by some lifestyle choices. Dr. Mike, could you name some of these lifestyle factors that can lead to fatigue?
As was mentioned, lack of sleep. On the other end, too much sleep also can cause fatigue or being tired all the time. Substances like alcohol, too much coffee.
And the diet as well can be a factor of that. Any one of these factors or a combination of them, as you mentioned, Dr. Mike, can lead you repeatedly exhausted. Now, I'd like to talk about obesity or the lifestyle of eating unhealthily because there's an upward trend in obesity right now in the Philippines. And many overweight people don't even realize that they fall into this category. And being overweight will most likely cause fatigue, which can affect your quality of life. Now, Dr. Sarte, how does obesity increase the risk of fatigue?
If somebody is obese, they are overweight, they have a tendency to be more sluggish. And unfortunately, it can be also connected to lack or not enough exercise. And when you look at all of these things, they could be connected also with affecting our sleep. Especially being obese can also be a lifestyle factor that can cause fatigue.
And similarly, being underweight can also result in fatigue. This is why a healthy diet is necessary. If you lack energy throughout the day, you should probably look at what you're eating. Doc Jing, what are the basic guidelines of a healthy diet that could make someone minimize episodes of fatigue?
For the diet, it should be well-portioned. What they say, yung pinggang Pinoy, na there should be greens, a lot of greens, enough carbohydrates, enough proteins. A lot of people think that they should forego carbohydrates. A lot of people say that they should rely on proteins. But I think it's important to have an equal amount of energy as well as the nutrients.
And a healthy, balanced diet is an indispensable way to boost your energy and prevent fatigue. Another important factor is physical activity. Doc Jing, can you explain to our viewers how does physical activity impact fatigue?
When you're exercising, somehow we release this endorphins. Our bodies release endorphins that make us feel more energetic and even happier. So it's really important for everybody to have adequate physical activity. But sometimes, in people with medical causes of fatigue, hindi talaga enough yung exercise lang. So while it's important that we keep on harping about physical activity, it's very important to know the underlying cause of the fatigue. Because if we are able to treat that, then the patient's fatigue might be managed by itself.
Okay. And exercising also improves your sleep, another crucial factor in managing fatigue. Typically, adults need around 7 to 9 hours of sleep every night. Any less or any more, as Dr. Mike said, can negatively impact your day-to-day. But many people struggle to get the sleep that they need. Dr. Mike, when it comes to sleep, should our viewers focus on the amount of sleep or the quality of sleep that they get?
We're referring to the level of sleep where you should have both a combination of a shallow and deep level of sleep. Plus, as you mentioned, the duration. So you have to have a good number of hours of sleep, and at the same time, it should also be deep. So you should have both factors when you have good sleep.
Okay. Dr. Mike, can you give us some tips on practicing good sleep hygiene?
Very important is your bedroom. It should be quiet, it should be dark, and it should be cooler. Staying away from gadgets close to bedtime because the light can affect our quality of sleep. Being exposed to sunlight, or at least being exposed to this during the day, can strengthen our sleep-wake phase cycle. Because at night, when in the bedroom, when it's dark, that's when melatonin, our sleep hormone, is released and effectively improves and strengthens our sleep.
Yes. However, there are still some people with sleep disorders, so please consult your doctor or sleep specialist if you are having trouble sleeping. Now, an avoidable factor of fatigue that is very common among Filipinos is shift work, especially today. Our brave doctors and nurses, uniformed personnel, and essential workers have been taking on more shifts and working unconventional hours. Dr. Mike, what are some of the practical ways that our shift workers can fight workplace fatigue?
Definitely, they have to make sure that if they are in a shift, they work at night and they're sleeping during the day, they have to change their atmosphere in the daytime. They have to have in their bedroom, they have to have curtains. They have try their best to make that area very quiet and very dark, so that even if they're working at night, they're sleeping during the day, they have just to make the most out of it.
Yes, and while it's really challenging to find just one solution, we hope these tips help you and your employers promote a safe space. Now, if you're getting enough sleep, good nutrition, and regular exercise, but still find it hard to fulfill your day's work, your fatigue might be caused by a medical condition. Or in today's reality, it can even be caused by COVID-19. We'll discuss this after a short break. We're in connection to healthcare on MedTalk Health Talk on CNN Philippines. Stay with us. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk. We all know the feeling of being tired. Usually, after a good night's sleep and much needed rest, we're good to go. But when that tiredness is overwhelming and can't be remedied by sleep and rest or even your diet, you're experiencing fatigue. And there are a few medical conditions that could be behind it, which we would like you to know. Dr. Geraldine, what are some of the medical conditions that are known to cause fatigue?
In my field, in rheumatology, number one would be autoimmune conditions, wherein the immune system is confused, and instead of fighting pathogens, viruses, bacteria, cancer cells, the immune system is fighting your own body. So that's one big umbrella of causes. It could be hormonal issues, for example, hypo or hyperthyroidism, diabetes, could be lack of steroid in the body or lack of cortisol in Addison's disease. It could be infections from viruses, bacteria, and many others.
So a medical condition known as rheumatoid arthritis may cause someone to feel fatigue chronically. Could you explain this to our viewers?
Rheumatoid arthritis is just one of the many autoimmune conditions. So it means that your immune system is somehow fighting your own joints, possibly your other organs such as the lungs, the eyes. No? So person with autoimmune conditions, so not just rheumatoid arthritis, there is a higher level of what we call inflammatory or namamaga, no, na cytokines or just some substances in the body, which can lead to a feeling of fatigue or sluggishness or overall lowered level of energy.
Doc Jing, whenever someone hears rheumatoid arthritis, they think that this is a disease of the elderly. Is this the case?
And actually, it's not just a disease of the elderly. It usually happens among females of reproductive age, but it can also happen among males. It can also occur in children and senior citizens. So it can be something you'll see on anyone of any age, any sex, but it's more common among females of the reproductive age. So that's around 20s to 40s.
Okay, so if you find yourself in that category and you feel that your fatigue doesn't go away with simple rest or a good diet or even exercise, it's good to have a checkup with your rheumatologist. What do you advise the viewers when it comes to symptomatology and when to see a doctor?
If you have fatigue for a long time, maybe more than 2 weeks, more than 4 weeks, and you've tried what you can to eliminate it, for example, you've tried to get good sleep, you've tried to improve your diet, your lifestyle, and you still feel fatigue, debilitating fatigue. No? So my patients say, para silang naupos na kandila or parang low bat. Especially if you have other symptoms, then it's probably the best time to try to talk to your doctor about it.
Very good. Now, in the world that we live in today, COVID-19 is a culprit of fatigue. Dr. Mike, how does the fear and anxiety possibly brought about by this pandemic, by COVID-19, how can this increase the risk of mental fatigue?
Especially with what's going on, and the anxiety and stress, knowing that the disease is there. We also find out that we lost a friend, a loved one, so it can bring grief. Aside from the overall concern that we're in lockdown, we work from home, our movements are limited. Definitely, it will change a lot of routines that we used to do when we were not in this situation. So definitely, COVID can change a lot of things in our day-to-day activities, in what we've been doing, aside from the psychological impact it can have on us.
That's right. Now, the reality of the pandemic can make finding motivation or getting a good night's rest more difficult than usual. Know that you're not alone. And while these are stressful and unusual times, there are steps that you can take to protect both your mental and physical health as well. Now, Dr. Mike, what can we do? How can we address this fatigue brought about by COVID-19?
As much as possible, if we can avoid taking a pill, that's actually recommended. And how can we do that? Of course, we can try to be active during the day, have a good schedule of work or study during the day, try to avoid naps as much as possible, make sure that we have a scheduled pattern of sleep. We sleep almost the same at night, and importantly, wake up the same time so that your internal body clock is not affected. Of course, exercise, okay? As much as possible, if we can go out into the sunlight, remember, vitamin D also protects against COVID-19, and it can also help regulate and strengthen our sleep-wake phase cycle.
COVID-19 can also lead to some of these mental health problems. Social distancing can often make people feel isolated as well as lonely, and these can result in depression as well as grief. Dr. Jing, what are healthy ways to deal with the stress of COVID-19 in your opinion?
It's really advisable to make sure that you set aside time in a day not to read anything about COVID, or not to read your Viber groups and all those scary stories, not to watch the news first. Kahit 1 hour a day lang, just give time to yourself, to not be scared. It helps if you can try to be busy with other things. Hindi yung parang puro COVID na lang, puro COVID, because it's tiring to hear about death and suffering all the time. We owe it to ourselves to be mentally healthy so that we can also take care of the people inside our house, outside our homes, our work. We try to get proper sleep, as Doc Mike said, and we try to reduce the noise. For example, if you want to read about COVID, you just try to tune in to reliable sources instead of being flooded by so many misinformations that will cause so much stress and eventually fatigue.
Yes. Now, how will your doctor diagnose and treat your fatigue? We'll tell you what to expect after a short break. You're watching Med Talk Health Talk on CNN Philippines. Stay with us. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines, where your health comes first. If you've tried to make some lifestyle changes and still find yourself feeling fatigued, it might be time to consult your doctor. And you can expect your doctor to ask a few questions and run some tests. Doc Jing, what are some of the questions that you would ask a patient on their first visit?
First, we'll ask for their age, we'll ask for their lifestyle, what type of work they do. We ask for their symptoms. So we run down on the review of systems. We ask if there's fever, if there's weight loss, weight gain, and other things like that. So review of systems, we also ask for the medical history of the family, because there might be conditions that run in families that can cause fatigue, such as yung hormonal conditions. Yun. And then we proceed with physical examination. And depending on what we find overall, history and physical exam, we might order certain tests, blood tests, urine tests, just to see if we can eliminate other causes or find the actual cause of the patient's fatigue and other symptoms.
Don't be surprised if your doctor also orders other tests. Your doctor will want to rule out other problems by conducting them. Now, in terms of getting that elusive good night's rest, what can those who have trouble sleeping expect when they first come to you, Dr. Mike?
Part of the diagnosis actually is suggesting to them things that they can already do. Relaxation techniques, breathing exercises, meditation. Giving those suggestions would help alleviate, for example, anxiety, since I do treat insomnia, anxiety, grief, depression, all of which can also pervade right now during COVID-19. Further tests will come as the need arises.
Yes. Now, Dr. Jing, what type of treatment can one expect in terms of medication? Is it as simple as giving a medication for a week and then okay na sila? Or can the viewers expect some lifelong treatment depending on their condition?
Doc Freddy, it will depend on the diagnosis. So whatever we find in our tests, for example, we find that the patient has lupus, then of course the treatment might have to be lifelong. But if, for example, upon examination, we find that the only cause of the fatigue is, for example, lifestyle issues, then whatever treatment we share with our patient, it might not have to be something that they'll carry on for the rest of their lives. It may have to be temporary. So bottom line, as with any condition, we have to know the exact cause, the diagnosis, so we can offer the best treatment possible.
Ultimately, if it isn't caused by an underlying issue, there are concrete ways to prevent fatigue before it worsens. What can our viewers learn in order to prevent things from becoming worse?
If the cause of the fatigue is because of problem sleeping, that's easy to address. I always tell my patients to have in mind, live healthy. That includes exercising, walking. You don't have to go directly under the sunlight, but open your window so that the sun gets through. You can do simple exercises from where you are, not only in the morning, but also in the afternoon. Just as long as you don't do it at night, that's okay. Staying away too much alcohol or caffeinated beverages. Eating healthy is very important. Staying away from too much of the stimulus on television. I agree with Dr. Geraldine about the news. Unfortunately, a lot of the news about COVID can be very depressing. So stay away from that. Meditation is important. breathing exercise is important. Relaxation techniques is important.
These healthy habits fight fatigue, boost your energy levels, and improve your overall well-being. Thank you very much, sleep specialist Dr. Michael Sarte and rheumatologist Dr. Geraldine Zamora, for joining us today. We appreciate your time and effort with us very much. We're here to build a healthier future for you. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk, only on CNN Philippines.